Namaste, I'm Dr. Nagaraj Puttaswamy, a laparoscopic and a bariatric surgeon at Punya Hospitals, Bangalore. I am with 27 years of vast experience. I performed over 17,000 laparoscopic surgical procedures successfully. So I'll share my clinical experience with you people for better understanding of medical conditions. Gallstones or gallbladder stones are stones which are generally formed in the gallbladder. The gallbladder is an organ which is adjacent to the liver and it is a part of the biliary system. The function of the gallbladder is basically to concentrate a small portion of bile which is received from the liver and again put that concentrated bile back into the intestine. So during this process, if there is an imbalance in cholesterol and bile salts, there is a possibility of stone formation, that is metabolic cause, and if there is an infective reason, there would be stone formation again. So simple to tell is the gallbladder stones form either because of metabolic imbalance or because of some amount of infection with the gallbladder. So this can trigger aggressive problems in the days to come. Patients with gallstones may be asymptomatic. They may not even have any discomfort at all. But many patients in early stages, they present as if like they have gastritis. I mean to say that they may have nausea, sensation of vomiting, vague burning sensation in the abdomen, particularly after having a meal, sometimes vomiting sensation or maybe vomit also. These are early symptoms of gallstone presentation. Okay, many times there will be very thin line of difference between gastritis and early gallstone symptoms because both of them present in the similar manner and both of them get relieved with taking antigastric treatment. I mean to tell related to antigastric treatment, we may have syrups or may have tablets that even the gallstone symptoms also will regress. So it's very, very challenging to just tell without investigations. But once the gallbladder gets infected or traumatic, then the symptoms become very, very specific and we clinically able to diagnose. But in early days, it's very, very difficult to differentiate and tell whether the symptoms presented by the patient are because of gastritis or gallstones. Yes, definitely. Gallstones many a times would be asymptomatic. Though they present with symptoms of very minimal gastritis or dyspepsia, many a times gallstones will be there quietly. We saw that silent or quiet gallstones. But if gallstones are picked up, then ideal would be a planned surgical procedures in the days to come so that they will not cause acute surgical or medical conditions. Silent gallstones. Do we need to operate on them? Do we need to treat them medically or surgically? Is a big and $1 million question. So because they are not presenting with symptoms and why do we intervene is the biggest question because most of the physicians have a difference with the operating surgeon. But with my experience, I've seen a lot of patients who had carried silent gallstones for years but acutely presenting with a surgical or a medical complication and presenting themselves in the ICU. So what I personally feel is to fix the gallbladder at their convenient time and they can plan the surgical procedure with ease. Then most of the times it will be a daycare activity. Okay, when a patient would require laparoscopic cholecystectomy, that is gallbladder surgery laparoscopically. The conditions where the gallbladder surgery has to be done is one with simple gallstones, particularly presenting with symptoms, that is acute cholecystitis, that is one condition. And if the patient has raised bilirubin level and altered liver enzyme, that's an indication that is the gallbladder is going in for infection. Patient has acute pain, vomiting, radiating to back, that's an indication that there is cholecystitis. There is a clinical feature called Murphy's sign, so that's an indication. Ultrasound picked up and then says that there is gallbladder wall thickening and also there are stones, and if there is a stone which is impacted in the cystic duct, all these are definite indications for cholecystitis or cholecystectomy. But apart from gallstones, apart from a simple cholecystitis, there are mucocele of gallbladder, empyema of gallbladder, gangrenous gallbladder, perforated gallbladder. All these are related to gallbladder infection and complications. But sometimes we see gallbladder mass, even that's an indication for laparoscopic surgical procedure. Other gallbladder conditions which require cholecystectomy would be a polyp or a cancer of the gallbladder. These are common conditions where a laparoscopic cholecystectomy has to be advised and planned for. Gallbladder stones, if they are well formed, it's relatively challenging to advise medical management. See, gallbladder stones, many a times there will be microliths or maybe sludge. Sludge is something like a slurry, a soft stone. Those stones or maybe the slurry or the sludge can get dissolved with the help of drugs, particularly medical drugs, deoxycholic acid derivatives. That will definitely be helpful. But if there is a established stone and if it is quite hard, I don't usually suggest those patients to undergo medical treatment because it will be a tiring exercise putting the patient on medical treatment for months together and following up of the patient with multiple or repeated ultrasound. We try to suggest patients, but some patients are particular taking medical treatment and they try to keep measuring the stone size. But I don't think there will be a big difference if an established stone is there. If it is early microlith or sludge, definitely medical treatment would help. Related to gallbladder stones and symptoms, home remedies. Say we always try and find gastritis getting treated and managed at home. Say taking lukewarm water, taking hot water with honey, some nimbu. All this are attempted and then they get symptomatically better. But gallstones per se, I don't feel they will definitely get better with home remedies. But the symptoms may regress, particularly features of gastritis-like symptoms will definitely get better with home remedies and also some antacids. But they will not treat gallstones. Okay, gallbladder surgery and safety. So this is practiced over 50 years and across the globe. So gallbladder, though it is not a vestigial organ, I don't think it's a major organ which has any big say on digestive function or any other physiological function. Except for concentrating the bile, it has not much of importance in digestive activity. Say bile which is secreted by the liver will directly go to the intestine and a small portion of bile will go to the gallbladder, stay there, get concentrated and get released into the intestine after a meal, which will facilitate better absorption of fat and fat soluble vitamins. But if the bile is otherwise flowing directly from the liver into the intestine, still this function will get carried. So removal of gallbladder is safe, will not induce any sort of physiological or digestive disturbance. Say normal life after gallbladder surgery. Yes, definitely. See, only personally, I have now performed over 5,000 gallbladder surgeries in my career of 27 years and above. So I don't see any patient coming back when trying to tell that I am not living a normal life. The patient can have normal diet, do normal physical activity and do everything possible as a normal individual. See, many a times I get patients trying to tell that should I stop eating fatty food, should I stop eating non-vegetarian type of food, or something like that, or dairy material. But I say that you say maybe before the surgery I would suggest all this just because I don't want the gallbladder stones to get spilled onto the biliary tree or the common bile duct and cause problems. If the patient, gallbladder contracts much harder and if the cystic duct is little wide, one of the stones, smaller stones can get spilled into the main biliary duct. So that would cause problems. Before surgery, there would be some specific advice of dietary changes. But after surgery, the patient can absolutely live normal life. Generally, we try to tell patients to avoid fatty meal and heavy food before surgery, and particularly protein type of food, non-vegetarian type of food, dairy products. Just because the patient possibly would have more discomfort before surgery, particularly where patient is having acute cholestasis, the gallbladder tries to contract after every meal. So if the meal is little on the heavier side, the patient may have distress and difficulty. So I try to advise all these patients to avoid fatty food, high protein meal, and then oily stuff of food, and also spicy food. See, if it is a relatively bland food, that will be the ideal scenario. Post-surgery, possibly the patient can live normal life and consume everything possible. So there is nothing like dietary restriction following a laparoscopic cholecystectomy. The gallstone complications. So a simple complication would be one of the gallstones can come and get obstructed or block the cystic duct, that is the exit of the gallbladder, and which will get connected to the main common hepatic duct to form the common bile duct. A stone can get blocked there and cause a mucocele, and which will lead on to empyema of gallbladder, which is an acute surgical emergency. This empyema can become gangrenous gallbladder, it may form a mass, it may form a pericholecystic abscess, and sometimes it may perforate also. These are all life-threatening complications. A simple gallbladder stone can get spilled onto the main biliary duct, that is the common bile duct, and this stone can probably block the main duct at the entry into the small intestine, causing obstructive jaundice. So, which will alarm the patient to get into a surgical emergency, where the patient would undergo series of investigation, liver function test, ultrasound abdomen, MRCP, and sometimes ERCP. ERCP is an intervention where endoscopically we go and then try to dilate the biliary duct and then retrieve the stone which is obstructing it. These are all complex scenarios with the patient experiencing discomfort of pain, vomiting, fever, jaundice. Sometimes patient will develop a condition called acute pancreatitis or acute cholangitis, where the patient would probably land up in ICU. So this is not what we would look up on the patient to see. We want patients to come and see the doctor, maybe see any specialist close by relatively early. So it becomes easy for both the doctor and this patient to experience a surgical procedure. So gallstones, if they are medically treated, particularly a sludge or a small stone, particularly microlith, what we call, this can be medically treated and then this can come back, of course. But if gallbladder surgery is done, whether it is laparoscopically or open surgery, definitely there is no reason a gallstone should happen. But a stone can happen in the biliary tree. If there is high possibility of stone formation, particularly in conditions where hemolysis is aggressive, there is biliary deposit inside the biliary tree and biliary stones can happen. Gallbladder per se is removed after a surgical procedure, so there is no reason a patient can get back gallbladder stones. But if the cystic duct, which is the duct which is connecting the gallbladder to the common bile duct, is little longer, sometimes we try to cut or cut the cystic duct closer to the gallbladder and leave behind the longer cystic duct. Stone can form there and mimic gallbladder like symptoms, I mean to say cholecystitis like symptoms. So we call this as post-cholecystectomy syndrome. So we should be aware of this, and it's not that it is a recurrence, it is possibly a stone was left behind there, and we can probably again correct that condition. It's a difficult question to answer, that how gallbladder stones can be prevented. It's not under an individual's control. See, many a times it is familial. A mother has it, a daughter can carry it, or a sister of the same person can carry it, father has it, and it goes many a times in family because of metabolic imbalance. And also some amount of infection which is happening in the gallbladder can trigger formation of gallstone. But it's not in the control of the individual to stop the formation of gallstones. See, a definite balanced diet would probably avoid gallstones. Less of fatty food, yes, possibly yes, and less of vegetarian, patient being closer to a vegetarian stuff, type of food, possibly can avoid formation of gallstones. But definitely these are all theoretical, but not very proven. So anybody, for that matter, can develop a gallstone, and there is no definite way to avoid formation of gallstones. There is a general perception that only gallstones are formed in old individuals. Definitely no. Any patient or any individual can get the gallbladder stones. I have operated on a 2-year-old child. So from that age group, anybody can get. But commonly it is seen in the middle age group. Gallstones always cause symptoms is not a true statement to make. Many a times gallstones are silent. They never even present with any symptoms. Surprisingly, they may cause or present with acute complicated scenario. Every gallstone patient may not require an emergency surgery. It can be a planned work, but patient with acute symptoms or complicated gallbladder conditions definitely would require surgery. Medicines can help gallbladder stones to get resolved, particularly when it is in the form of a sludge or a microlith, but an established stone will most of the times would not be able to dissolve the stone. Life is never difficult after gallbladder removal. It is relatively normal and safe.